Cancer. The very word strikes fear into the hearts of many. But what exactly is it? Simply put, cancer is a disease of cells. Our bodies are made up of trillions of cells, each programmed to grow and divide in an orderly manner. Cancer disrupts this delicate balance. In cancer, cells begin to grow uncontrollably, ignoring the normal signals that tell them when to stop. Imagine a car speeding out of control, unable to stop at a red light. That's what happens in cancer. These abnormal cells can form a mass called a tumor. Not all tumors are cancerous. Some tumors are benign, meaning they are not cancerous and do not spread to other parts of the body. However, malignant tumors are cancerous and can invade nearby tissues and organs. Even more concerning, cancer cells can break away from the original tumor and travel through the bloodstream or lymphatic system to other parts of the body, forming new tumors. This process is called metastasis. Cancer is not a single disease, but rather a group of over 100 different diseases, each with its own unique characteristics. Cancers are often classified by the location in the body where they originate, or by the type of cell they arise from. Some of the most common types of cancer include lung cancer, breast cancer, colorectal cancer, prostate cancer, and skin cancer. Each of these cancers has its own set of risk factors, symptoms, and treatment options. For example, lung cancer, the leading cause of cancer deaths worldwide, is often linked to smoking, while skin cancer is strongly associated with exposure to ultraviolet radiation from the sun. Breast cancer, on the other hand, is influenced by a combination of genetic and lifestyle factors. What causes cancer? This is a question that has puzzled scientists for decades. We now know that cancer is a complex disease with multiple contributing factors, including genetics, lifestyle choices, environmental exposures, and even certain infections. It's important to understand that cancer is rarely caused by a single factor alone. Rather, it is the interplay of these various factors that ultimately leads to the development of cancer. Think of it like a recipe for disaster, with each ingredient contributing to the final outcome. Some risk factors, such as age and family history, are beyond our control. However, others, such as smoking, diet, and physical activity, are modifiable, meaning we can take steps to reduce our risk. Our genes play a crucial role in our risk of developing cancer. Genes are like blueprints that carry instructions for how our cells grow and divide. Sometimes these blueprints contain errors called mutations, which can increase the likelihood of cancer development. These mutations can be inherited from our parents, meaning they are passed down through families. For example, mutations in the BRCA1 and BRCA2 genes significantly increase the risk of breast and ovarian cancers. It's important to note that inheriting a gene mutation does not guarantee that you will develop cancer. It simply means you have an increased risk compared to the general population. Many people with these mutations never develop cancer, while others develop it later in life than they might have otherwise. Section 5. Environmental and lifestyle risk factors. While our genes lay the foundation, our environment and lifestyle choices can significantly influence whether or not cancer develops. Think of it like this: our genes load the gun, but our environment and lifestyle pull the trigger. Smoking is perhaps the most well-known environmental risk factor for cancer, linked to lung, mouth, throat, bladder, and several other types of cancer. The chemicals in tobacco smoke damage DNA and disrupt normal cell growth. Diet also plays a role, with diets high in processed meats, red meat, and sugary drinks linked to an increased risk of certain cancers. On the other hand, diets rich in fruits, vegetables, and whole grains are associated with a lower risk. Other lifestyle factors, such as alcohol consumption, lack of physical activity, and obesity, also contribute to cancer risk. The good news is that many of these factors are modifiable, meaning we have the power to reduce our risk by making healthier choices. Section 6. Recognizing the signs and symptoms of cancer. Cancer can manifest in a myriad of ways, and its symptoms often depend on the type and location of the cancer. Some cancers, like skin cancer, may present with visible changes, such as a new mole or a sore that doesn't heal. Others, however, may not cause any noticeable symptoms in their early stages. This is why regular screenings and checkups are crucial, as they can help detect cancer early when it's most treatable. Common symptoms of cancer can include unexplained weight loss, persistent fatigue, pain, skin changes, unusual bleeding or discharge, and changes in bowel or bladder habits. If you experience any unusual or persistent symptoms, it's essential to consult with your doctor promptly. Section 7. Diagnosis, the key to effective treatment. Diagnosing cancer involves a combination of physical exams, imaging tests, and laboratory procedures. Early diagnosis is critical, as it allows for timely treatment and improves the chances of a successful outcome. Your doctor will likely begin by taking a detailed medical history and performing a physical exam to assess your overall health and look for any signs or symptoms of cancer. Depending on your symptoms and risk factors, they may recommend further testing. Imaging tests such as X-rays, kinetic scans, MRI scans, and ultrasounds can help visualize internal organs and tissues, allowing doctors to detect tumors and assess their size and location. Biopsies, which involve taking a small sample of tissue for examination under a microscope, are often necessary to confirm a cancer diagnosis and determine the specific type of cancer. Section 8. Treatment options, a multidisciplinary approach. Cancer treatment is not one size fits all. The best approach depends on a variety of factors, including the type and stage of cancer, the patient's overall health and preferences, and the potential benefits and risks of each treatment option. Surgery, radiation therapy, and chemotherapy are the cornerstones of cancer treatment. Surgery aims to remove the tumor and surrounding tissues, while radiation therapy uses high-energy rays to kill cancer cells. Chemotherapy, on the other hand, involves using drugs to destroy cancer cells throughout the body. In recent years, newer treatment options such as immunotherapy and targeted therapy have emerged as promising approaches for certain cancers. Immunotherapy harnesses the body's own immune system to fight cancer, while targeted therapy uses drugs that specifically target cancer cells, minimizing damage to healthy cells. Section 9. Prevention and early detection, your best defense. While we can't control all the factors that contribute to cancer, there are steps we can take to significantly reduce our risk and improve our chances of early detection. Lifestyle modifications play a crucial role in cancer prevention. Quitting smoking, limiting alcohol consumption, maintaining a healthy weight, staying physically active, and adopting a balanced diet rich in fruits, vegetables, and whole grains can substantially lower your risk. Regular cancer screenings are also paramount. Screenings can detect cancer in its early stages when treatment is most effective. Talk to your doctor about which screenings are right for you based on your age, gender, and risk factors. Remember, knowledge is power. By understanding the causes of cancer, recognizing the signs and symptoms, and taking proactive steps for prevention and early detection, you can take charge of your health and reduce your risk of this potentially devastating disease.